Hi, this is Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. Topic for today is the question I get asked every single day is, how does my diabetes affect my heart? So diabetes is one of the most significant risk factors for heart disease. It's up there with a family history. When we think about diabetics, we think about how do we prevent them from developing heart disease. So one of the best things is to have good diabetic control, have the hemoglobin A1C, which is your long-acting blood test to look at sugar control. If I stick your finger now and your sugar's 200, does that mean you're diabetic? No, it means your sugar's 200 right now. And if I stick your finger now and your sugar's 86, does that mean you're not diabetic? No, it means right now your sugar's 86. So the hemoglobin A1C looks at an average sugar over a 3-month period. So that helps us in the sense that if your sugar's 200 but your hemoglobin A1C is normal, then I'm going to say, okay, well, I ate bad last night and that's why it's high, but for the 3 months it's been really good. On the other hand, let's say somebody fasts for 2 days before they go for their blood test and their finger stick is good but their A1C is high, then I know although it's good today, it hasn't been good for a period of time. So that being said, when we think about diabetics, we're very aggressive at treating all their risk factors, not just the diabetes, but their smoking, their blood pressure, and their cholesterol, aggressive cholesterol control. One of the things that we think about in diabetics is what's called silent ischemia. So ischemia is basically when someone gets chest pain, chest tightness, that's ischemia, that's heart muscle not getting enough blood and oxygen. Silent ischemia means that somebody can be having angina or a heart attack and not have the typical symptoms of heart disease. Diabetics get more fatigue than they get chest pain, and that's often mistaken as I'm getting older, I'm out of shape, I haven't exercised, I had COVID, I used to smoke, and they present later or bad things happen where they don't end up presenting to the doctor. So diabetes control is paramount to preventing heart disease. Not just the diabetes control, but all the other risk factors need to be treated, and they need to be treated aggressively, and any symptoms of fatigue or decreased exercise tolerance would tip us off to looking for blocked arteries even without chest pain. So to summarize, this is Dr. Rick Pumill from Cross County Cardiology and Whiteboard Wednesdays, trying to stress the point that a diabetic has a very high risk of heart disease, but we can dramatically reduce that with proper medical therapy and diet and exercise interventions.